Welcome to my YouTube channel. In this video we will talk about vaginal yeast infection. So before going to the video, make sure to hit the like, comment and subscribe button so you don't miss any update from us. What is a vaginal yeast infection? A vaginal yeast infection is a type of fungal infection. Your body contains a kind of yeast called Candida, which causes vaginal yeast infections. Yeast is a type of fungus, and Candida is a specific type of yeast. When this yeast is in balance within your body, there are no problems. But when the yeast is out of balance, it rapidly grows, and you can get a yeast infection. A yeast infection causes burning, itching, redness in your vulva, the outside parts of your vagina, and changes to your vaginal discharge. A yeast infection isn't a sexually transmitted infection, STI. What does a vaginal yeast infection look like? The way your vulva looks and feels and the type of discharge that comes from your vagina may change if you have a yeast infection. The area of skin just outside your vaginal opening may itch and burn. The itching and burning can feel worse when you pee or have sex. Your vaginal discharge may become thicker and lumpier, but it shouldn't smell different. Not everyone experiences symptoms or has the same symptoms. Who gets vaginal yeast infections? Anyone with a vagina can get a yeast infection. They're most common after puberty and before menopause. Certain factors can put you at a higher risk of developing a yeast infection, but yeast infections are very common and highly treatable. How common are vaginal yeast infections? Up to 75% of women or people assigned female at birth, AFAB, will have at least one vaginal yeast infection in their life, and over half will get 2 or more in their lifetime. Certain factors can increase your risk of getting a vaginal yeast infection. Some of those are: 1. Using antibiotics, birth control pills or certain steroids. 2. Being pregnant. 3. Having a health condition that weakens your immune system. 4. Having unmanaged diabetes. Certain lifestyle risk factors also increase your risk of a vaginal yeast infection, such as: 1. Sitting in a wet bathing suit. 2. Not changing out of sweaty clothes. 3. Wearing scented tampons or using a vaginal deodorant. Symptoms and causes. There are several telltale signs of a vaginal yeast infection. These symptoms can include: 1. An itchy or burning sensation in your vagina and vulva. 2. A thick, white vaginal discharge with a consistency of cottage cheese. 3. Redness and swelling of your vagina and vulva. 4. Small cuts or tiny cracks in the skin of your vulva because of fragile skin in the area. 5. A burning feeling when you pee. In some cases, another symptom of a vaginal yeast infection can be pain during sex. Diagnosis and tests. Your healthcare provider diagnoses a vaginal yeast infection. You'll need to go in for an appointment and discuss your symptoms. Your provider may need to take a sample of discharge from your vagina to confirm a yeast infection. The combination of your symptoms and the discharge sample will tell your healthcare provider what type of yeast infection you have and how to treat it. Management and treatment. Antifungal medications treat most vaginal yeast infections. The specific medication depends on the severity of the infection. Your healthcare provider will prescribe the best treatment based on your symptoms and condition. Antifungal medications work by fighting yeast overgrowth in your body. Medications are either oral, usually given in 1 dose of fluconazole by mouth, or topical, used daily for up to 7 days. You may apply topical medications to your vaginal area or place them inside your vagina, suppository, using an applicator. Some common antifungal medications are miconazole, monostat, and turconazole. How long do yeast infections last? Most yeast infections clear up with medication after a few days, but it may take a full week. More severe cases may last longer and take longer to treat. Make sure you use the medication as directed and don't stop taking it too soon, or the infection may come back. Prevention. 1. Not douching. Douching can kill bacteria that actually control fungus. 2. Avoiding the use of feminine deodorants. 3. Not using scented tampons or pads. 4. Changing out of wet clothing, like bathing suits or gym clothes, as soon as you can. 5. Wearing cotton underwear and loose-fitting clothes. 6. Using water-based sexual lubricants. 7. Keeping your blood sugar levels in a normal range if you have diabetes. Thanks for watching my video. I hope you like the video. If you do, make sure to hit the like, comment and share button.